Hello, Africa. You're live on another episode of Ladyz Digest, where issues in the world of women are discussed. Ladyz Digest is proudly brought to you by AAU TV, the voice of higher education in Africa. Today, we'll be discussing sexually transmitted infections or diseases known as STIs or STDs during pregnancy. And we will know that how it can affect your pregnancy and your baby. And sexually transmitted infections are transmitted through sex. Yeah, through sexual activities. And if not treated, it can be passed on from mother to child. And it can really cause serious problems if left untreated. This is a minimum we'll be discussing. If you want to know more about this episode, do stay tuned. I'm Joan Ikuya-Iyoha. Welcome back from the quick break, and as I introduced earlier on, we are discussing STIs during pregnancy, and I have with me here, as usual, my expert, my gynecologist, Dr. Kweju Owunsu-Ansah, is here to help us deal with this topic. Welcome, Doc.
Thank you.
How has your week been? It's already Thursday.
It's been okay.
Yeah. And now you're keeping safe during this period with the second phase?
Same as before.
Same as before.
Distancing,
yeah,
protocols,
yeah, the necessary things. And we heard that this time, I think the symptoms are quite different, unlike before.
Oh, we just have a new variant of the virus.
Okay.
So, which means a bit more aggressive than the previous one that came earlier on in 2020.
2020, yeah. So this is coming with its own 2021.
Yes.
Well, God will see us.
So that's what's accounting for.
Yes, that's true.
The changes.
Okay, okay. So today we are discussing STIs, sexually transmitted infections or diseases, STDs, during pregnancy. And I gave a basic introduction, like transmitted during sex, and it can also be passed through from mother to child. So I would want to know if you can explain what STIs really are, the structure, how it is contracted, and any other thing before we now move towards the relationship with pregnancy.
Okay, so sexually transmitted diseases or illnesses are just like any other infection that is transmitted during sex. So it could be vaginal sex, oral sex, anal sex. Any of them could transmit some infections. So the presupposes that one person may have had the infection, and then over time, depending on number of encounters or duration of encounters, could transmit it through sex to another person. So yes, it's the usual STI as before.
Okay, so the basic thing is that it's only transmitted through sex. It's not like UTIs, it can be gotten through toilet.
Usually no. It's behind the microorganism concentrated in body fluids.
Okay.
Or they may be certain lesions or sores that one you come in contact with in certain areas. You're looking at the genital area, the mouth, and all those things. So once you come in contact with them, you're likely to have the microorganism and then get the infection. Okay,
that's why, for instance, I think HIV, for instance, even if you've not had, I think, sexual intercourse, I know of someone who got it, he said through toothbrush. I think he had a sore in the gum or something.
Exactly.
Yeah, so it has to do with...
So some are with contact with the lesions and some are in body fluids, so blood, saliva, semen, vaginal discharge, anything.
Okay. So can you highlight some of types of STIs?
So we have quite a number of them. Usually we have the curable ones and the quote-unquote incurable ones. So we have the gonorrhea, syphilis, chlamydia. Those are curable, usually antibiotics and all that. And then we have like hepatitis, HIV, and those are lifelong, basically. You can manage, but you cannot cure. So those are the main broad ones.
Okay. So talk about the symptoms. I want to know what are some signs and symptoms of them. And in this case, do they cut across all forms of, all types of these STIs you mentioned, like the gonorrhea and chlamydia also? And are they the same? Do the symptoms cut across? And if not, what are the different symptoms we should be looking out for?
Well, there are different symptoms. So usually you get either a lesion or pain or a sore in the genital area. So,
before you continue, what's the lesion?
Well, lesion is just like maybe like a sore, something like you find a little spot or something. Yeah. So let's say like a sore, like a bump, or an ulcer at either the genital region or the anal region or the mouth. Those are the main areas you find something physical. You have a discharge, you have pain or urination, you have some other discharge offensive with maybe pus or bloody, or you may have pain during sex. So those are all low abdominal pain. Those are the main general or discharge in the man, like penile discharge, if it's the man as well. Or sometimes you are unaware. So sometimes some of the diseases are such that maybe syphilis, you are unaware, so maybe your partner may have symptoms before the woman might realize that I have something. So sometimes you are not even aware you have anything.
So at times they really don't show.
Yes, sometimes it's pretty quiet. Chlamydia can be very silent. So you might have it, not knowing you have it, but then it's causing havoc on the genital organs and the internal ones as well.
I see. So let's bring it down to pregnancy. I would want to know how likely pregnant women are in contracting or getting these diseases, because for me, I want to think that maybe pregnant women would have some extra antibodies that protect them from these things. So how likely are pregnant women to get these infections that you've mentioned?
Well, being part of the population, yes, pregnant women are also at risk. And because pregnancy is actually the reverse, it's actually a state of a reduced immunity. So you don't have any special adaptation. So you may even have, the risk might even be higher for a pregnant woman than a non-pregnant woman. Yes, but the same STIs can affect the woman during pregnancy.
So STIs during the antenatal checks and all, are STIs particularly or part of the routine checks that are done?
Yes, so we have commonly what we screen for is HIV, hepatitis B, sometimes hepatitis C, and then syphilis. So those are routinely part of antenatal lab work. So once you get pregnant, they will check for that. And even HIV is done twice. So beginning and just about closer third trimester, about to deliver, we check as well. So, yes.
Just in case you've contracted it.
Because it has pregnancy. A window period, so about 3 months on average. So you could check and be negative and check later and then you're positive.
So it's only HIV, I guess, that's done twice. The others are once.
The rest, once initial negative, we will not screen again. Because usually we do that so we can pick it up and then try and put in measures to prevent transmission to the baby.
So
those are the main ones that we check. So other ones may come in if your clinician suspects that there might be other, like herpes. Maybe you have a lesion on your genital. So you think you have herpes, they will screen you. So it depends on what your doctor finds. He or she may add on other STI screens aside the regular ones.
I watched the movie and I heard of this herpes you just mentioned. The symptoms, they are the normal itching?
No, herpes usually will give you a little bumps or sores that usually have a burning effect to it. Sometimes they are pretty silent. You see multiple sores on the genital area, sometimes on the lip as well. What we call a cold sore. So someone is unwell, you get a little bump on your lip. That's actually herpes, the oral version.
I see.
But you have the genital version as well. So And sometimes people have it, it gets latent. So when you have periods of reduced immunity or you're unwell, it pops up. You get like a rebound effect. Yeah.
I see. So before we go for a break, something just popped up. I was just discussing with my colleague, and he said men are, how did they put it? When men get this STIs, at times they just go without even treatments. That's his own view. Yeah, and I was like, I don't think so. And for women, and he said because of the makeup of the woman's body and the male, I don't know if you can just clear us on that before we continue.
Once it's proven to be an STI, it rarely cures itself.
Okay.
Usually they have phases, like syphilis. You could have a sore that will come within 9 to 90 days of exposure to the microorganism, either through sex or anything. And that initial sore, which is a painless sore on the genital area, may close by itself.
I see.
It doesn't mean that's the end of the line.
Yeah, that's true.
It probably will move into phase 2, which will come back 3-6 months later in another secondary phase. So once it's a proven STI, they really go away by themselves.
Okay.
Really, I mean, you may have acute episode, things are quiet, you may think, oh, I'm fine. But no, sometimes men have a discharge of gonorrhea,
I see.
it goes, takes some bunch of antibiotics, it goes away. But later you get complications where either you have persistent pain when you urinate, or you have what we call a stricture, your urethra, the tube through the urepas, starts to narrow.
Wow.
So it may go quiet, but then complications might be ahead.
Okay. So it may go as you said, but it's the complications which might really cause serious havoc.
Exactly, maybe more serious than the initial
that's very
episodes.
true. Thanks for the clarification on that. So we'll go for a quick break, and when we return, we'll continue. This is Ladyz Digest, and in case you just joined, you can watch us on our social media handles at Ladyz Digest on Instagram and Facebook and YouTube at the Association of African Universities. I'll be right back. Welcome back. In case you just joined in, this is Ladyz Digest, and we are discussing STIs during pregnancy. And remember, you can catch us up on our social media handles at Ladyz Digest on Instagram and Facebook and YouTube at the Association of African Universities. We are still discussing STIs during pregnancy. Doc, so I want to know, you've mentioned some are treatable, curable, and incurable. But I want to know how dangerous these STIs are, especially with regards to pregnancy. So I want to know pre-pregnancy, before pregnancy, how dangerous it is, then during pregnancy and post-pregnancy, the different stages and their effects.
Okay, it depends on the, usually the STIs tend to affect the genital area, as well as so the external genital organs, the internal genital organs also may be affected. Okay. So sometimes it can even go up further into the womb, into the tubes.
Okay.
So STIs before pregnancy, gonorrhea, chlamydia can affect your tubes.
Okay.
Causes the tubes to close or block, leads to infertility, chronic pelvic pain, like that, on recurrent episodes of that. So that is one aspect of it. In pregnancy, when you're already pregnant. Sometimes, apart from the acute episode, we have some that can also affect the baby.
Okay.
So depending on what stage you get it and which type of infection you could have recurrent miscarriages, or you could have reduced or retarded fetal growth or baby's growth. So it's sort of the growth of the baby is affected. Okay.
Doesn't go as it should.
Exactly. And then severe forms, depending on what, can also lead to fetal death.
Wow.
Okay.
So that's one cause of maternal mortality.
Exactly. If it's not discovered early enough. Then you could have the episodes of complications as well. Let's say preterm delivery, depending on which type of infection you have, that can cause early delivery as well. So maybe preterm, so the risk of prematurity for the baby also increases, depending on the kind of infection you have. So it can cause a wide spectrum of things inside pregnancy. Post-pregnancy, STIs can lead to probably just pelvic infection with this overwhelming sepsis, depending on the degree and which one you have. You know, so those are the main potential outcomes.
Okay. So HIV, for instance, what will be its effects on, let's say, pregnancy? I know it may not have to do with infertility, but what will be its effect on during pregnancy?
Well, HIV usually, when you have it, it can be pretty silent. Okay, till you get to advanced stages, there are no obvious signs. A lot of people HIV positive don't even know they are.
Sure, especially when they are treating themselves. Or not even
before diagnosis.
That's true.
Because sometimes you get a mild fever when you are converting. But not in everybody. Or even in a place where malaria is endemic, you might play down as one of those.
Malaria.
So most people don't even know they have it, so they get tested. So, and it's such that it becomes a big thing when it's been there for years, because it's a virus, so it's a slowly growing virus. So it takes about averagely 10 years to really run you down. So you could be fine for years. So usually when they come in, the mother is fine. So our screening is aimed at protecting the baby. Because it can go across the placenta to the baby. That's in the virus. So in antenatal screening and programs, we're aiming at saving the baby. So once you come in, if you have a problem, as in depending on the stage you've got into, there are four main stages of the HIV progression. You will look at what you have, but most people are very fine. Problem is stage 1, they're not even sure what they are doing. They are positive. So we screen you, and then we put in medication to limit transmission to the baby. And that's our main objective throughout, unless you have some symptoms. That's the main objective.
So most times, I guess the treatments are, well, those would be very special treatments, especially for the HIV.
Usually we just start you on antiviral drugs, antiretroviral drugs. So medication specific for HIV, which limits the progression of the virus. So you start as early by end of your, depending on when, once we pick you up, we start you. But the earlier you start, the better in terms of limiting the transmission. So if you had known better, so usually when you come in, we screen, and even if you come in late, there are interventions to come, even in labor. Let's say you've been positive or you didn't know you're in labor. There are interventions to try and limit the transmission to the baby at that point.
I see. That's if the baby hasn't contracted it.
Yes. So usually we do all we can, and then we test baby in about 18 months. To see the baby's actual status.
So I think that's the next one we're supposed to talk about, baby status. So, for instance, a lady was tested, not really HIV, but let's say gonorrhea or whatever, and there were complications during pregnancy, which, were treated. But then there may be suspicions that it might have affected the baby. So do you undergo, as you say, 18 months, but that's for HIV. But are other tests done maybe when the baby is just newly born for other diseases, like maybe gonorrhea or something, for the baby to test the baby status?
Usually, once we pick up, yes, we would screen the baby as well. Usually, commonly, gonorrhea will manifest as there's this eye infection that... Eye infection. Baby will start getting eye infection within 2 or 3 days of birth. Because they pass through the birth canal and they pick up the infection there. So that would usually would prompt you to start screening. Unless maybe you would have screened the woman already. But it all depends on the quality of antenatal care you had. Because if you've been in a good center where they've taken care of, usually these things will be picked up. And then interventions made to to before you even get to labor. But sometimes, let's say, in a big referral center where people come from all sorts of places at different times, you may end up having a scenario where probably someone was not adequately screened, but there are new clinician things that we should screen for this or screen for that.
Okay.
And then you pick it up. So yes, commonly you pick up the eye infection from the baby. For gonorrhea and sometimes chlamydia as well.
Okay. But for the herpes, they can't have those sores at the...
Yeah, so herpes may have sores there, at the genital area as well.
Wow.
So once you are examined, you will see. It depends on what stage. If you come early in pregnancy and your sores are quite extensive, and maybe it's your first infection, or the first time it's happening to you, the risk of transmission of the baby is high. So it may even resort to delivering your baby by a C-section. So you may start medication and then look at delivering you by C-section from 36, 37, 38 weeks, thereabouts, because of the extensiveness of the lesions over there. But sometimes, if it's recurrent, you've had it before, these are like multiple episodes, the risk of transmission of the baby is low. So sometimes you start medication, all right, but you can even allow a vaginal delivery. If it's so, you have to be assessed. To know which plan will work best for you.
Okay. So it all depends on assessing and knowing how the stage and how complicated the whole thing is. So finally, we want to talk about the preventive measures. I don't know if these measures would cut across both generally and for pregnant women, but I would just want to know some preventive measures that women can adapt to reduce they even getting contracting the STIs in general. And if they are for pregnant women separate.
No, it's actually the same. I mean, it works for both non-pregnant and pregnant. So by its very nature, sexually transmitted illness, the best way is no sex.
Okay, no sex. Abstinence.
Abstinence. So then, once you are not doing sex in any form, vaginal, oral, anal, you're fine.
Okay.
Beyond that, so we are looking at the same thing, like ABC. Being faithful with a partner who is also faithful.
Okay.
That's very crucial, because you could be faithful and then one person goes around and picks stuff and brings it home.
And then you are faithful, but the other
Exactly.
party.
So being faithful with another faithful person.
Faithful partner. Wow.
Yes. And then finally, condom use.
Okay.
So those are the main things. And then discouraging multiple partners, as I said earlier. So that's where the risk increases.
So I think how will I put it?
But beyond that, maybe once you are affected, we treat.
You treat.
Or manage.
So here, your lifestyle doesn't come in terms of like maybe what you eat or hygiene in general.
No. It's not really a big thing, because the source is an infection, a microorganism, be it bacteria or virus. And usually the reservoir or the host is another person. Who has the infection already. So once you don't come in contact with that person, you are presumably safe.
It's automatic.
Or you are not sharing personal items with somebody. You are presumably safe.
So I think for couples who definitely, I know some couples who be like, we are married, why should we be using condom? Then I guess for that one, the faithfulness is just the only option.
Well, the faithfulness is the only option. I mean, yes. We usually would recommend, once you pick up an STI, as part of the management, we need to also see all the contacts, all the people that person has had sex with, and treat as well. So it's like contact tracing of partners. And this should go as far back as 6 months from the date you are seeing a person. You see a person in January, anybody she slept with since June, July, should be found and treated as well, ideally. So that's how far-reaching it goes. So, yes, if one partner in a marriage setup picks it, the other part has to be treated. Yes, and then they may not feel the need to use, but then if you are being treated, you need to use condoms
if you have
ideally,
to. If
because
not, I think
it's a
maybe
barrier
abstinence.
contraception that prevents
Yes.
infection transmission.
Yeah.
So usually either you stay away from the sex till you are
Uh-huh.
fully cleared,
Treated,
or if you want to, then you probably have to use a condom. So that scenario could account for your condom use.
Okay, that's very
in pregnancy.
true. All right, thank you very much, Doc, for availing us your time, even in this tight period. We really appreciate it, and we hope to see more of you. Yeah, this has been Ladyz Digest, and I've been your host, John Ikuyayo, and we've been discussing STIs during pregnancy. Remember, you can join us on our social media handles at Ladyz Digest on Instagram and Facebook and YouTube, Association of African Universities. Still will come your way next time. Many thanks to my production team and my makeup artist for making me this beautiful. Bye.